Welcome to today's episode, where we're diving into the intricate world of co-occurring disorders, specifically how we can effectively treat addiction and mental health issues together. This episode serves as a companion to the course titled 3 CE Hours Co-occurring Disorders, Treating Addiction and Mental Health Together, offered by Therapy Trainings. If you're a mental health professional, counselor, or therapist, you'll find valuable insights here that can elevate your practice and enhance the lives of those you serve. In today's episode, we'll cover three main areas. First, we'll discuss the importance of understanding co-occurring disorders. Second, we'll explore effective treatment approaches. And finally, we'll address some common misconceptions surrounding this topic. By the end, you'll have a clearer picture of how to navigate the complexities of co-occurring disorders and some actionable steps you can take in your practice. Let's start with the basics. What exactly are co-occurring disorders? Well, in simple terms, co-occurring disorders refer to the simultaneous presence of a mental health disorder and a substance use disorder. You might be wondering, why is it so crucial to understand these disorders together? The reason is straightforward. Treating them in isolation can lead to poorer outcomes for clients. When we view addiction and mental health as separate issues, we miss the nuanced interplay between them that can significantly affect a person's recovery journey. Research shows that individuals with co-occurring disorders are at a higher risk for relapse, hospitalization, and even mental health crises. This means that, as practitioners, we need to adopt a comprehensive approach, one that treats both issues concurrently. In the course offered by Therapy Trainings, we delve into the various models that support integrated treatment and emphasize the importance of a holistic perspective on recovery. Now, let's take a moment to discuss some effective treatment approaches. One key concept covered in the course is the biopsychosocial model of care. This model encourages us to look beyond just the symptoms of addiction or mental health issues. Instead, it prompts us to consider biological factors like genetics and brain chemistry, psychological factors, including a person's thoughts and feelings, and social factors, such as their environment and support systems. By taking all these elements into account, we can develop more tailored and effective treatment plans. But how do we implement this model in practice? One effective strategy is through the use of integrated treatment teams. These teams typically consist of various professionals, including therapists, social workers, and addiction counselors, all working collaboratively to create a unified treatment strategy. This team-based approach not only helps in providing comprehensive care, but also fosters a sense of community and support for the client. Another powerful tool we discussed in the course is motivational interviewing. This client-centered approach is particularly beneficial when working with individuals struggling with ambivalence about change. By using open-ended questions, reflective listening, and affirmations, practitioners can help clients explore their thoughts and feelings about both their mental health and substance use issues. This process can be pivotal in motivating clients to commit to treatment. Now let's shift gears for a moment and address some common misconceptions surrounding co-occurring disorders. One of the most prevalent myths is that you must treat one disorder before you can address the other. This belief can be damaging and can prevent individuals from receiving the comprehensive care they truly need. In reality, research supports the effectiveness of treating both disorders simultaneously. Integrated treatment can lead to better recovery outcomes, as individuals learn to manage both their mental health and addiction issues in tandem. Another misconception is that co-occurring disorders are rare. In fact, studies suggest that nearly half of individuals with a severe mental health disorder also struggle with addiction. This highlights the importance of screening for both issues during the initial assessment phase. As practitioners, we have the responsibility to ask the right questions and be vigilant in our assessments, ensuring we do not overlook a potential co-occurring disorder. As we continue our exploration of co-occurring disorders, let's consider the role of trauma. Many individuals with co-occurring disorders have histories of trauma, which can significantly impact their recovery journey. Trauma-informed care is essential in addressing the unique needs of this population. This approach emphasizes safety, choice, and empowerment, allowing clients to reclaim their narratives and engage in treatment at their own pace. Integrating trauma-informed practices into our treatment plans can involve various techniques, such as psychoeducation about the effects of trauma, mindfulness practices, and creating a safe space for clients to share their experiences. By recognizing the profound impact of trauma, we can foster a more empathetic and effective treatment environment. Now, I'd like to share an anecdote that illustrates the power of integrated treatment. I once worked with a client who struggled with severe anxiety and alcohol dependency. For years, they'd been in and out of treatment programs, but nothing seemed to stick. It wasn't until we adopted an integrated approach, addressing both their anxiety through cognitive behavioral techniques and their addiction with motivational interviewing, that we began to see real progress. This client eventually went on to complete their treatment and found healthier coping mechanisms for their anxiety, significantly reducing their reliance on alcohol. This success story serves as a powerful reminder of the potential that lies within integrated treatment. As we approach the conclusion of this episode, I want to leave you with some thought-provoking insights. The journey of treating co-occurring disorders is undoubtedly complex, but it is also incredibly rewarding. By embracing an integrated approach, we not only improve the lives of our clients, but also contribute to a broader understanding of mental health and addiction in our communities. I encourage you to continuously seek knowledge and training in this area. The course offered by Therapy Trainings dives deeper into these concepts and provides practical strategies you can implement in your practice. I highly recommend checking it out at therapytrainings.com. As we wrap up, remember that the landscape of mental health and addiction is ever evolving. Staying informed and adaptable is essential for providing the best care possible. Let's continue to challenge misconceptions, advocate for integrated treatment, and empower our clients on their recovery journeys. Thank you for joining me in this exploration of co-occurring disorders. I hope you found this episode enlightening and that it inspires you to deepen your understanding and practice in this vital area. Don't forget to visit therapytrainings.com for more courses and resources that can enhance your professional development. Until next time, take care of yourselves and one another.